Hello and welcome to Aging Well with Dr. Bob. I'm Dr. Bob Flaherty. I'm a family physician and today I'll be discussing nocturnal leg cramps. I'll talk about what causes this common and painful problem and what does not, how to prevent leg cramps, and how to treat them when they do strike. The information in this presentation is supported by high-quality medical research and expert medical opinion, and references are given at the bottom of many screens. This presentation is for information only. Before you act on anything you learn here, be sure to discuss it with your doctor, physician assistant, or nurse practitioner. Shakespeare knew what we hoped for when he wrote, "Sleep that knits up the ravelled sleeve of care, the death of each day's life, sore labor's bath, balm of hurt minds, great nature's second course, chief nourisher in life's feast." And so we settled in for a nice sleep. And then suddenly we're awakened in great pain with a leg cramp. These nocturnal leg cramps are involuntary muscle contractions of the hamstrings, calf muscles, pretibia muscles, or foot muscles. They're sudden, sharp, intense, incapacitating pain. These are often relieved by stretching, and they're not associated with involuntary leg movement. The nocturnal leg cramps are episodic. They'll often come a few days a week, but sometimes less frequently. And in fact, some people can go for weeks at a time only to have several days of leg cramps. The cramps on general last about 9 minutes. And during the cramp, the involved muscles are tender and hard to touch. 50 to 60% of people over age 50 have leg cramps, and that frequency increases with age. They're slightly more common in women. About 20% of people have daily leg cramps. 20% also have daytime leg cramps. Although these usually occur in deep sleep or when starting to awaken and are often triggered by wake-up stretching. They usually involve the calf or the foot and rarely the thigh. Nocturnal leg cramps can be confused with some other leg conditions. They're different from restless leg syndrome, or RLS, and a lot of patients and even physicians confuse RLS and nocturnal leg cramps because RLS also occurs at night, but it's an irresistible urge to move the legs. There's unpleasant sensations such as aches, pulling, itching, sensations of bugs under the skin or tingling and tightness, but it's not painful. The muscles are not cramping, but RLS can aggravate and disturb your sleep. Nocturnal leg cramps are also different from peripheral artery disease, which, as this image shows, is a blockage of the arteries that take oxygen and blood to the muscles in your legs. This can be aching and sometimes cramping, usually occurs while awake and occurs with walking, and it is relieved by rest. So, in many ways, it's quite the opposite of nocturnal leg cramps. Nocturnal leg cramps are also different from peripheral neuropathy, which is damage to the peripheral nerves. It's more than pain. Peripheral neuropathy has symptoms typically of tingling or freezing, loss of feeling, increased sensitivity, and sharp jabbing pain or burning sensation or numbness. Peripheral neuropathy can be constant or episodic, and some medications like gabapentin can help peripheral neuropathy. But peripheral neuropathy is not the cramping and muscle contractions of nocturnal leg cramps. Well, considering how many people suffer from nocturnal leg cramps, it's a bit of a surprise that we really don't understand what's going on. First, a little anatomy lesson. When you decide to move your leg, cells in the cerebral cortex in the brain send a signal down the spinal nerve to a little switching center in the spinal cord that sends a signal into the motor nerve that goes to the muscle and moves the leg. There's another bit of anatomy that's useful, though, that causes muscles to move, and that's the reflex arc. How many of us have stepped on a stone or stepped on a Lego and instantly, and without any conscious action on our part, we pull our foot away? And that's due to a reflex. The skin sensors detect the painful stimulus and send a nerve signal into the spinal cord, where an interneuron interprets it and connects to the motor nerve that goes to the muscle. And that motor nerve stimulates the muscle to contract, again, without any control or action on your part. Some people think that perhaps in this motor end plate, the nocturnal leg cramps occur because of uncontrolled release of chemicals from the nerve to stimulate the muscle. I tend to think, though, that it's probably happening in this interneuron, where this interneuron gets confused and starts sending repetitive, frequent nerve signals to the muscle to cause the contraction. And that's why the muscle goes into what we call tetany, or severe contraction, and causes the pain. Well, whatever the cause, we know that nocturnal leg cramps are associated with aging, with cancer treatments, particularly chemotherapy, with cardiovascular disease, with cirrhosis of the liver, with end-stage renal disease and hemodialysis, and also with lumbar canal stenosis, which is calcium deposits that develop in the spinal canal and pinch the spinal cord. Nocturnal leg cramps are also associated with peripheral neuropathy, such as with diabetes, with peripheral vascular disease, the blockage of the arteries that I showed you before, with venous insufficiency or varicose veins, with osteoarthritis, and also in pregnancy. Research has shown that nocturnal leg cramps are probably not caused by dehydration or by potassium, sodium, magnesium, or calcium abnormalities. They don't seem to be caused by elevated blood sugar or thyroid disease, and not by mild or moderate kidney disease, and not by medications. Statins have been blamed for causing muscle cramps, and although that's still debatable, it doesn't appear that statins are associated with causing nocturnal leg cramps. Well, although we don't know much about what causes nocturnal leg cramps, we do know what can help treat a cramp when it occurs, and that's stretching. Get out of bed and stretch the back and the front of each leg. Straighten the forward leg so that both legs are straight and stretched. Hold the position until the cramp relaxes. And then, if necessary, switch legs and repeat. Notice this fella has arthritis, so he can't straighten his legs completely, but you should try to straighten those knees and straighten the legs to put the maximum stretch on the muscles. An alternative stretch is, while lying in bed, pull the front of your foot up towards your head, flexing the ankle upward, as is shown in this picture. Hold it in that position until the cramp relaxes, and massage the tight muscle while stretching, as that can also help. Something called focus relaxation seems strange, but it can also work to treat a cramp. At the onset of the cramp, visualize the location of the cramp. As you exhale, imagine you're breathing warmth into the area, and imagine the muscle relaxing as it gets warm. This may take a few tries to master the technique, but it really does seem to work. Well, preventing a cramp is a lot better than having to treat a cramp. We do know some things that don't seem to prevent cramps. For decades, we've used quinine, And that may help, but we found that it's dangerous and can cause heart problems. We know that magnesium supplements don't seem to help, and drugs like diltiazem, verapamil, and gabapentin don't seem to help, nor do muscle relaxers like Norflex or Soma. And B-complex vitamins and vitamin E don't seem to work either. But we do know that massage, either deep tissue massage or myofascial release, can decrease the frequency and intensity of nocturnal leg cramps. Walking may help some people, and CPAP may help some people as well. Also, friends have told me that wearing socks to sleep can decrease the frequency and intensity of their nocturnal leg cramps. Stretching before you go to bed can definitely decrease the frequency and intensity of nocturnal leg cramps. Before bed, stretch the back and front of each leg. Straighten the forward leg so that both legs are straight and stretched, and hold each stretch for 30 seconds. And then switch legs. This is the same procedure that you use to treat a cramp. Now, I don't usually recommend medications in these presentations, and I'm not beholden to either of the companies I'm going to mention. But I'm impressed that Caleb Trees' Old Amish Formula, a liquid that you can get over the counter at most grocery stores and drugstores, taken before bed, seems to really decrease the frequency and intensity of nocturnal leg cramps. With Caleb Trees' Old Amish Formula, and it comes in with two different labels, but it's all the same, either Old Amish Muscle Tonic or the labels that says stops leg and foot cramps in about 1 minute. With either one of these, before bed, take 1 capful in 2 to 4 ounces of cold water or juice. And you follow this with 2 to 4 ounces of cold water. This does seem to help. Also, I've had friends and patients that have found Highlands for legs cramps, which are pills that you can get, again, over the counter at drugstores and at grocery stores. And they've found these to be helpful as well. Well, I do have a final wish for you then, and that is that you can manage your nocturnal leg cramps and that you can sleep well. Thank you for watching this presentation. I hope you found it informative and helpful. If you did, please click like below and subscribe to keep up to date with new presentations. Best wishes and age well.